My name is Olaiton Guntoye and I'm making a presentation on diverticulitis. So let's go straight into the details. So by way of definition, this is actually a disorder that occurs in the gastrointestinal tract, that's the digestive tract. So and especially it happens in the intestine. So it occurs when there are when pouches, small pouch-like structures develop in the intestine. Those structures are referred to as diverticular. So when these structures become infected, when it becomes inflamed, then you have the resulting condition will be diverticulitis. And actually having a diverticular on its own without infection, without inflammation, does not result in diverticulitis. It becomes diverticulitis when that pouch is infected and is inflamed. And just like the picture on this slide, the first picture is the diverticular on its own, and that's referred to as diverticulosis. That is having the diverticular is diverticulosis. Now the second picture is showing when that diverticular has been infected and inflamed. So you could see the yellow coloration over there. So these two conditions, diverticulosis and diverticulitis, both of them are referred to as diverticular disease. Now, the causes are not well spelled out, but there are risk factors, and some of them are high body weight. That's somebody is being overweight, is obese. Then consumption of very low fiber diet. Then high consumption of red meat. Smoking is also a risk factor. Then sedentary lifestyle, reduced physical activity. Then this condition also has some genetic undertone, so heredity plays a critical role. Then what are the symptoms? Individuals that come down with this disease, they have fever, then they pass blood-stained stools, they feel nauseated, and they feel bloated also. Then when the abdominal region is touched, they feel pain. Then also, what are the treatment options for patients with this condition? The treatment option depends on the case presentation. So for patients with mild cases of diverticulitis, antibiotics are recommended. There's also recommended for them to adjust their diet. So antibiotics, they are medications that are used to treat infections. Remember I said that this condition is when a diverticular becomes infected. So to treat that infection, antibiotics are recommended. And then because this condition is associated with low fiber intake, it is recommended that patients with this disease condition, they consume fiber-rich foods. And then for cases that are complicated, they undergo surgery, most times surgical resection, so that to improve their life quality. So and then also it's also recommended that fruits, vegetable, and a lot of water should be consumed to reduce constipation, and then it makes bowel movements very easy. What are the long-term effects? For diverticulitis, if one of the long-term effects is formation of pus, that's referred to as abscess. So this happens when the infected area, pus begin to collect around the infected area, and this pus, if it leaks through the intestinal wall, it could lead to inflammation of the peritoneum. Now that condition is referred to as peritonitis, and peritonitis is life-threatening. So also we have scarring in the affected intestinal area that can make the place a little bit constricted. Then the intestinal wall could be perforated from this condition as well. The conclusion is that it's recommended for us, everybody, to consume fiber-rich diet to avoid this disorder. These are the references used in preparing this slide.